Welcome everyone. Thank you for joining us today. My name is Becca Melnick. I am the Associate Director of Admissions here at the Yale School of Public Health. And our session today is focused on student research, conducting research as a student here at the school. I'm joined by 4 of our current students who are going to talk about their experiences. And I'm just going to kind of start with a few quick housekeeping things. So first, we are recording this session today. We want to be sure that everybody can participate in our open house events, even if they can't be here live. So just wanted to make sure everybody was aware of that, that it will be recorded and posted. So if you participate, which we hope you do, that will be included in the recording. And we want this to be helpful for you. We know you have a lot to consider in exploring different graduate programs, understanding the experience here at Yale. So please, I encourage you to ask any questions. I have some lined up to start, but please feel free to either use the raise hand feature if you want to turn your mic and your camera on, or use the chat to ask questions. I wish that we could have been in person together, but I'm glad we can arrange this virtually. But if you feel comfortable turning your camera on now, just so we can all see each other, it would definitely be appreciated, but also understand that kind of everyone's in a different place. Other kind of little logistics, we have been hosting events over the last few weeks. We hope you've been able to participate in a variety of them. All of the recordings either are already posted on the website or will be in the coming days. So feel free to take a look back if you need any of those. And if you have any other questions that either aren't answered today or aren't kind of relevant for this panel, we're always happy to help. So don't hesitate at all to reach out to our office, either to me directly or to our General Office of Admissions. So I think that's kind of all of my basic logistics. So I guess to start, I'm going to ask our 4 students. I'm joined today by Anne, Danielle, Alexander, and Julia. Maybe in that order, if you wouldn't mind introducing yourselves, name, the department you're in, your kind of general academic and professional experience or interest area, kind of what you were doing pre-YSPH, anything along those lines.
Okay. Hi, everyone. My name is Anne Basing. I am a first-year EMD student. And in terms of like professional interests, I'm very interested in the surveillance of viral respiratory pathogens, especially genomic surveillance. And so pre-YSPH, I graduated from Penn State with a biology degree in 2019. And for a year post-grad, I worked as a research tech in an epigenomics lab. And now I am here. And I think that's it. Is that it, Becca?
Okay. Sounds good.
Hi, I'm Danielle. I'm a first-year MPH student in the chronic disease epi department. I came straight from undergrad. I graduated in 2020 from UC Berkeley with a public health degree. And my main interest is in breast cancer epidemiology. During undergrad, I had the opportunity to work at City of Hope in Southern California with both medical oncologists and epidemiologists. And I was there for 3 years, just doing research, both virtually during the school year and in person over the summer. And I fell in love with it. So I decided to come to YSPH to learn more.
Hi, everybody. My name's Alex. He, him pronouns. I'm in the EMD department. And before I was at YSPH, I graduated from UC Davis in 2018 with my degree in global disease biology. And for the last 2 years, I've been working at a biotech company in California, doing sort of like early drug development stuff. But my true interests are in virology, and in emerging zoonotic diseases, especially respiratory viruses.
Hi, everyone, and welcome. My name is Julia. I'm in the Social and Behavioral Sciences department here at YSPH. Prior to YSPH, I graduated just this last year in 2020 from Vanderbilt University where my major was called Medicine, Health, and Society. It was kind of a mix between psych and public health, and during undergrad, I did a bit of research in a lab investigating motor development in infants with Down syndrome. But I am no longer doing research like that as a part of my public health education. My general research interests are early childhood development and childhood trauma, attachment, and the relationship between physical health and mental health. And future goals, I'll be applying to medical school this year. So if anyone is pre-med and has questions about that, feel free to let me know. And I think that's it, but welcome everyone. Nice to meet you.
Awesome. So you, Julia, kind of started on this topic of kind of what are your general, your research interests, but what's kind of the research work that you're doing? Can you kind of describe the research you're doing on campus, what that looks like, topics, or, kind of a broad overview?
Sure. Yeah. So I am in a few different labs here at the School of Public Health. So I'm in one lab in the Department of Psychology at Yale College, and that is called the Affect Regulation and Cognition Lab. And so as a part of that, I am looking at a daily diary study and data from that to determine if negative social interactions are associated with negative eating behaviors and cognitions in adolescents. And so I got into that lab. Basically, I'm from Connecticut, and so a few summers ago during undergrad, I interned in that lab. And so coming to YSPH, I already had that connection made and knew that I would be continuing my work there. And then earlier in the first semester at YSPH, I contacted one of my professors. Her name is Sarah Lowe, and she runs a lab called the Trauma and Mental Health Lab. And so I'm also a part of that. I'm working on a couple different studies right now. One is a study of mental health in healthcare workers during COVID, and the other one is transcribing mental health related interviews with adolescents in American Samoa. And then I am also a part of clinical research at the medical school in the Department of Psychiatry. It's called the Program for Obesity, Weight, and Eating Research. So we have studies for adults and teens who have difficulties with binge eating disorder and obesity.
Are we working our way back now?
Sure, yes.
So the research I've been doing is in Dr. Albert Koh's lab. He's primarily he works on leptospirosis, but due to the COVID-19 pandemic, we've been doing a lot of COVID stuff, SARS-CoV-2 research. So when I first started in his lab, I was hoping to streamline the Yale COVID biorepository and sort of write code to do data analysis and data entry faster and all of that. And after I finished that project, since then I've been working on sort of these interesting fringe cases of people who have had either COVID reinfection in the hospital or people who have had persistent COVID infection and have had kind of strange patient histories. So it's been really interesting, really rewarding research. And I'll say really quickly too, I think a lot of the research here at Yale is very applied research. And that's one of the main reasons that I decided to come to Yale specifically, was because there's two types of research. There's like basic research where you're looking at kind of like mechanisms and looking at sort of the small scale things. And then there's applied research, which takes that basis and then looks at how we can apply that to larger populations. And I think that a lot of the research here is that, which is really exciting and really rewarding all around.
Okay. So my research journey has kind of ramped up a little bit more recently, but I started work. When I came into YSPH, I wasn't really sure if I wanted to go the medical school route or if I wanted to pursue a PhD in cancer epi. And so I decided to start by gaining a little bit more exposure to oncology. And one of the reasons I chose YSPH was because Yale has an amazing cancer hospital, the Smilow Cancer Hospital, and there are also 15 or so cancer researchers here at Yale. And so I decided to reach out to an oncologist who also does a lot of public health research. Her name is Tara Stamp. And with her, I started out by looking at patient experience surveys from the cancer hospital. And this was definitely an eye-opening experience because she assumed when I came in that I knew what I was doing. And I basically just took everything I learned during first semester and the first couple weeks of my training and put that to use. She gave me a massive data set with 100 plus or 1,000 plus patients and said, do something cool with this. And so the freedom was nice, and it was wild to me to see that like this incredible researcher assumed that I knew what I was doing. And so I took what I learned during classes, and what I've been doing lately is been coding the patient responses into a list of 10 qualifiers and analyzing trends in patient experience pre-COVID, post-COVID in the cancer hospital. And like I said, that was incredible because I went in not really knowing how much I contribute to the research team and just being surprised by how much I've learned in such a short amount of time from YSPH. And recently I joined another research team. It's called the LEAN study, the Lifestyle, Exercise, and Nutrition Study. And I reached out to my faculty advisor, Professor Irwin. Each of us are assigned a faculty advisor when we come into YSPH, ideally with similar research interests. And I thought that coming into YSPH, I wanted to deviate from my experience of diet and exercise interventions, but she actually came into my cancer epidemiology course and gave a little bit about her research, and I realized how much I missed it. So I just sent her an email and I said, is there room in your lab? And she said, our first meeting's on Monday. Come on in. And it's been so cool working in this lab. It's a massive randomized control trial. We're in the enrollment phase right now. We have 175 cancer patients, and we're looking at establishing a timeline to determine when diet and exercise interventions are the most effective. And we're looking at women who are specifically starting chemo right now and looking at if early diet and exercise interventions improve long-term survival, decrease reoccurrence rates, and decrease mortality rates. So that's a long-winded synopsis of what I've been doing lately.
So I work for Connecticut's Emerging Infections Program, which is a collaboration between Yale, the CDC, and the Connecticut Department of Health. The Connecticut Emerging Infections Program has so many different projects that students can get involved in. Like there's a project with HPV that my roommate helps work on. There's a project that looks at foodborne outbreaks in the state of Connecticut. And I work for the viral respiratory disease surveillance project, which pre-COVID, they were looking at the surveillance of flu and RSV specifically, but now since I joined in the fall, we've almost exclusively looked at COVID. And so essentially what I've been doing is I have just been collecting data for our team and to get cleaned up and sent to the CDC. And it's been, that's not it. I'll give a little more background. So like what Alex was saying, Yale is really great at providing opportunities for applied research for students, and the EIP was a very big reason of why I chose Yale. I thought it was really, really cool that they had projects that really fit very specifically to my interests with surveillance of viral respiratory pathogens. And I thought it was also very cool that, if you join the EIP, the Emerging Infections Program during your first year, you can graduate saying that you had 2 years of experience working with not only a Connecticut Department of Health and Yale, but also the CDC. So I thought that was a really, really cool thing about the EIP. And so far it's been really rewarding. It's been really cool to get hands-on experience of what public health looks like during a pandemic, which has been, I'll be honest, a little stressful, but very, very rewarding, and a lot of, lessons learned through that.
That's great. Thank you. So here's my next question, is kind of two parts. Kind of one more logistic. Are you, for the work you're doing, are you physically in a lab? Are you at home? Kind of what does that experience look like in your kind of day-to-day? And then kind of the second piece is, how does this work fit in with the rest of your YSPH experience with your classes? Like kind of what does your typical week look like in kind of how your courses, your kind of any student groups, anything else kind of all comes together? You can go in any order.
I can start. I was actually really surprised coming to grad school how much free time we have. Like I said, I came straight from undergrad where almost every moment was accounted for. And I think part of it was being in COVID times and not having to commute to classes. But I really was surprised by how much time was left in our schedule for research. And I've been doing all of my work virtually, and I think as soon as the pandemic ends, hopefully it's soon, I'll be working directly in the survivorship clinic, trying to get more clinic hours and shadowing. But yeah, everyone wants to facilitate your research experience, and there's definitely enough time to accumulate that experience.
I'll go next. So I work in a wet lab, and I primarily do like virology wet lab research. And so I'm actually in the lab pretty much every other day, which has been really nice during the pandemic to like have somewhere to go, not just be at home. And it's sort of the way that my classes are set up this semester, it works out very well where Monday, Wednesday, Friday are pretty light on classes. So I can go into lab those days. And then Tuesday, Thursday are pretty much my class days. And in general, I mean, I think Yale, the reason I originally chose it is because there are so many opportunities here, and there's like Danielle said, I think I came from a really big university where you had to like fight and scrounge just to get every opportunity that you wanted. And here, professors like actively want to work with students. And it's very exciting reaching out to professors and just being like, hey, can I talk about your research? And you talk for a while, and then they're just like, if you're interested in working with me, just let me know, and that happens all the time in a way that's really exciting, and just the opportunities are endless. I saw someone said in the chat that they had no prior research experience, and will that inhibit them? No, I don't think so at all. I had prior research experience, but at the same time, what I'm doing now is quite a bit different than what I had done previously. So I haven't had any problems with that. And then how many hours? I think we're technically allowed to work 19 hours a week during the semester. It can be a little bit variable, but that's generally like the max. And that's definitely pushing it, but it's like a good amount of busy. For me, I think most of us here are probably the same kind of people that like to be a little bit busy. And that's like a good amount, in my opinion. And also you're working directly with your boss on stuff. If you're getting really overwhelmed, you can usually talk to them and just be like, hey, I have midterms this week. Can we can I not come into lab this week or something along those lines? I'll pass it on to Julia or Anne.
Sorry. I guess in terms of being in lab, most of my work is remote right now. Once I get the vaccine, it might be a different story. Except for one of the labs that I'm in does have an fMRI portion of the study that we're doing right now. And so when participants come in to get the MRI scan, I do often go in and help out with that. But that's really the only in-person component to my research right now. And just to echo what Alexander was saying, I'm not sure how many people share in this experience, but I think during undergrad for me, I didn't even go to a super big university, but it really felt like you had to fight tooth and nail to get any research experience at all. And I remember going in, and freshman year, I didn't do any research, but sophomore year, I probably cold emailed like 20 or 30 professors and maybe got a response from like 3. And then out of those 3, you know, not all of them were willing to meet or willing to take on an undergrad to teach. And so I think a lot of the research in undergrad for me was not so much me finding what I'm interested in, but really, you know, just seeing who out there would be willing to take a chance on me and to take me on. And it's the complete opposite here. I don't know if that's just a grad school thing or a Yale thing. I think it's probably a Yale thing because the professors here are really kind and collaborative. But here it's, you know, not so much seeing what professors want you, but really you reaching out and wanting professors and wanting labs and finding what you are interested in, and not really relying on others to, you know, give you experience, but you going out and finding whatever experience you want yourself. And also to go off of what Danielle was saying, with a lot of free time in grad school, I don't do well personally with free time. I just like don't know what to do with myself. And so I do work the full 19 hours in one of my labs, which is paid. And so when you get paid, then the 19 hours is the maximum. And then my other 2 labs are not paid. And so I do work in total more than 19 hours, which is definitely pushing it. I think especially in COVID right now, I'm going to be totally honest, my social calendar has been a little quieter than usual. And so trying to like fill that space and have more to do, just because I don't really like to, you know, sit around and do nothing. But even then, I think if I have any advice for anyone, it's don't do that. And even if you don't like to do nothing, everyone needs a break once in a while, and everyone needs some time to just like take a breather and, you know, get involved with as much as you want in any area that you want, but definitely factor in some breaks to your schedule and some time to just, you know, catch up on things if you need to, or, you know, engage in self-care, because we all need a little bit of that right now. So when you're looking for research opportunities, definitely keep that in mind.
And going off of what Julia just said, also similar experience. I came from a massive university where really the recruitment period for labs was the very beginning of the semester after people graduated. And at Yale, because there are so many different opportunities, you can start conducting research at any point in the semester. And I know plenty of people who haven't started doing research yet because they want to get a hold on their class schedule. Like I said, I started a new lab a couple of weeks ago, mid-semester, because I felt like I had enough time and I wanted to add something new. And so there is really no pressure to start at any given point. You can start whenever you feel comfortable, and there will be positions regardless.
And I guess, yeah, echoing what Danielle and Julia were saying, I feel like when I was in your position last year, I feel like a lot of advice that I was hearing was to, you know, it's okay to wait until your second semester to start research or a job or something, and just spend your first semester trying to get your footing and figure out, you know, how you want to manage your time as a grad student, because there was a transition, you know, and working my first semester, it was a little overwhelming. It wasn't, you know, it wasn't suffocating, but it was a lot, dealing with the transition and also a new job. So, you know, if you hop in at Yale and you're like, oh, I'm not exactly sure what my research interests are yet, or oh, I just want to kind of, you know, figure out how you know, what the workload is like as a student first, like no pressure to hop in immediately. But I guess to talk about my the hours I work and you know, where I'm working. So in terms of location, I've been remote for the emerging infections program since September. We do have an office very close to the public health building, about a block away. And by the time you all get here in the fall, we should all be back in the office. So I'm really looking forward to that. It sounds like a really cool collaborative space where you can talk to not only your own team, but to learn about surveillance projects with all the other teams. And then, oh yeah, hours, I work about 15 hours a week.
Thank you. So there's a lot of the questions you've all kind of answered in what you've been talking about. One kind of I want to address is there a lot of ongoing research a list of ongoing research projects you can have access to. I think not particularly because there's so much going on. I think, like has been mentioned, there's a lot of flexibility in kind of finding what you want kind of as you figure that out. We do have a list of the centers and programs we have that are specifically affiliated with the School of Public Health. And then there are hundreds of other centers and programs at Yale. I think that's a really good place to start. As is reaching out to faculty who have specific interests. You specifically, Michael, asked about international opportunities in refugee health. Like I know Kaveh Krishna focuses a lot on refugee health. He's a great person to reach out to. I think, excuse me, what we hear anecdotally is that, faculty members, even if they don't necessarily have an opportunity available in the work they're doing, are great resources to then kind of help you find other opportunities along kind of similar areas. There is a central posting of jobs on campus. So general student employment, teaching positions, research, that you will have access to once you have a net ID. Some positions are posted on there. That's also a good place to start if you're kind of unsure where you want to end up. And that you'll kind of have access to over the summer. So I don't know if anyone else wants to talk about kind of that experience of reaching out. I know some of you have touched on it, but kind of navigating those conversations with faculty members, kind of, you've talked a little bit about, but when you started, kind of if you have anything else on that topic.
I'll quickly add for like a list of ongoing research projects. The best place to start, in my opinion, is just from like the faculty page for your department if you're interested, because you can just look at like what they're researching, what the different professors are researching, because essentially anything they're researching could be a potential project that you could work on, just because there are so many opportunities. And if not, like Becca said, they'll figure out something for you or put you in connection with someone else that's also doing something similar.
Looking at some of the other questions. So one question that I kind of wanted to pose is, how is your research experience connected to your internship and or thesis? Are they kind of all independent from one another? Are you taking the approach you want them kind of all to complement each other? Kind of what is that intersection of those different experiences? What does that look like for each one of you?
So I decided I wanted to do something a little bit different for my internship over the summer. As I mentioned, I'm thinking about going to med school after I finish this program. And all of my background has been in breast cancer epi. And so I wanted to get a chance and get some exposure to another disease. And so I'm doing a research fellowship at Dana-Farber looking at prostate cancer and health disparities, both in the Boston area and in Africa. And so I will be doing some community outreach with Dana-Farber, looking at improving prostate cancer screening and treatment opportunities just in the Boston area. And I will also be doing research on nutrition access in Africa and how that affects prostate cancer screening, prevention, outcomes. And yeah, so I decided I wanted to do something completely different for mine.
I can go. So I'm a first year, I think all of the other panelists here also said that they're first years. So I've definitely thought about my thesis, though it's not, totally set in stone right now. In one of the labs that I'm in, I've been doing a lot of data analysis since, I started here in August. And so that's mostly finished. And I think the PI of that lab is sort of under the impression that that will be my thesis. And I have the opportunity to do that, though I'm also keeping other things in mind, maybe from my internship to do that for my thesis. So you really don't have to know exactly what you're going to be doing for your thesis until your second year. For my internship, I will be working at the School of Medicine in the clinical research lab on obesity and weight and eating research that I mentioned earlier. So I'll be doing research on development and implementation of a measure for weight stigma. So depending on, how that research goes, then I'll decide if that will be connected to my thesis from there.
So what I'm planning, my internship will be with the Emerging Infections Program, and I'm planning to have the project that I do as part of my internship to, generate data for my thesis. In the fall and, through the winter, I'm sure you guys are all familiar, there was that massive spike in COVID cases over break. So since I started, it's mostly been trying to tread water, keep your head above the water in terms of keeping up with data and all of that. But once I transition to my internship in the summer, I'll have my own project, and I'm hoping it'll be with the COVID variants that we're seeing, since I'm interested in genomic epidemiology, and then hopefully whatever happens with that project, I'll be able to use that data as my thesis.
I'm also going to be staying in where I'm doing my current research. I'm going to be staying in the lab with Dr. Ko. The reason I'm doing that is that I thought about potentially getting an internship with a State Department or with, I could have looked around at maybe the industry. But after talking to Dr. Ko, he was like, well, if you stay, you can continue to work and build on the relationships that you've already made in the lab. We have a lot of collaboration with the medical school. And so there's a lot of physicians there that we work with. And, I want to continue to foster those relationships. And so I decided I'm going to stay. We're still figuring out exactly what the project's going to be looking like. But that's the plan for now. And it'll probably be involving, there's a large research project going on right now about reinfections and vaccine escape variants and all of that kind of stuff at the hospital. So it'll probably involve something like that. And just, I saw someone had asked about considering doing a PhD. That's part of the reason why I'm going to continue to work in the lab. I could have gone and done something for the state, but I think in the end, I'm going to be applying to PhD programs this fall. And I wanted to continue to diversify my lab experience and make that a little bit more fleshed out and, strong, rather than doing something a little bit more out of my purview, even though it would be fun to experience something new in a little bit of a different way. I think overall, this is probably the best decision for me.
Great. So anyone else want to talk about kind of your post YSPH goals? If you mentioned a PhD program, med schools been mentioned. Are there kind of any other, are you all thinking about kind of more the transition to further education? Or are you thinking about other kind of applied avenues or more kind of in-depth research roles?
I'll just flesh out what I was going to say really, or what I was getting to. So I'm going to be applying to PhDs in virology. I wanted to do a PhD. I knew coming in, I kind of was thinking about a PhD, but I wanted to have a strong public health background first before I got into wet lab academia sort of side of things. And I think that decision has been really, it'll be fundamental to finishing my PhD in the future. A lot of people that I've talked to have said that, after they did their PhD, they really wish that they had a better sense of public health and all of that. And so I think if you're considering doing further research down the road or considering further degrees, I think it's a really good step in line to keep going.
So I am not planning on doing further schooling after I graduate. I'm definitely interested in applied public health practice after graduation. So, when I came to Yale, it was really important for me. I thought it would be very beneficial to, be a part of a research program where I would be able to get that applied public health practice. But like Alex said, really in a lot of the research that all of the professors are doing, you don't have to be doing something like the emerging infections program to get applied public health experience. But for me, yes, getting that experience with a Department of Health and the CDC was very, very important, because after graduation, I hope to work for either a state or federal Department of Health or public health agency. So yes.
I'm still teasing out my opportunities, to be completely honest. I actually set up a Zoom call with one of my professors on Friday, and I talked to her about why she decided to go into academia. And one of the things I love about Yale is any professor will be willing to do that and just sit down and answer questions about their trajectory, how they ended up where they are, and any recommendations they have. I think right now the dream would be to go to medical school, become a breast cancer oncologist, and use my MPH to continue conducting population level research. But as I'm going into further schooling and getting more exposure to everything I'm learning in all my classes, it's becoming a little less certain. So I think I'm just going to use the rest of this program to continue to tease that out and figure things out along the way.
I don't have too much more to add. Like I said before, I'm applying to medical school now. I've always kind of known that I wanted to go to medical school, except for a brief moment during undergrad when I thought maybe I would get a PhD in clinical psych instead. But I'm back on the med school track for a while now. And I just want to echo sort of like what Danielle was saying, even though I kind of came in knowing my plan and knowing, where I want to go from here. A lot of people don't, and I would say most people probably don't. And, if you come in thinking you want to do one thing, that changes for a lot of people along the way. And so if you're sitting here thinking, oh my God, I don't know what I want to do with my life and how am I going to figure that out? Like, you're totally not alone and you will figure it out. And a lot of people are in your same shoes. So I wouldn't worry if you're feeling a little lost.
Great. Thank you.
And also, Becca, you probably know more about this than me, but I think for most people, or for majority of people, this is kind of a terminal degree in a lot of ways. And like, you can really do a lot with this degree. You don't have to continue in education to have like a very complete career after this.
Yeah, about 20 to 25% of our students move on to further education. So that's med school, PhD programs, law school, kind of any combination of those. So yes, for most students, this is kind of the end. And I think that's why a big portion of our curriculum is focused on that translating research into practice. And I think regardless of your kind of desired outcome, if you plan to move into further education or go to work in the field, that concept of conducting research to use in practice and informing and having your practice be informed by research is really important to the school. And so, yes, a lot of our students, undertake great research projects with no intention of kind of continuing in that sort of academia, med school, PhD sort of kind of path, for sure. So I'm not sure if any of you would have kind of exposure to this. We've talked a little bit about that, Alex. You have more kind of wet lab experience. Others are kind of more in the qualitative assessment, but kind of, are there opportunities that are for students interested in healthcare management and policy, or things that are not kind of wet lab involved? I think we've touched on that a little, but I don't know if anyone has anything else to kind of add about the variety of types of projects on campus.
Yeah, I can speak to that. My roommate is in the health policy department, and she's working on completing a practicum right now. She was matched with the Connecticut state government, and so she's working with a state senator on expanding Husky access to undocumented mothers and extending prenatal care so they can receive coverage. And it has been so cool just hearing her updates. And she's working with, I think, 15 to 20 other YSPH students on the project, and the legislation just went through, the bill was just passed, and she was able to provide testimony in the public hearing. And so that's just one of the many many experiences outside of just like wet lab and the type of research that we do that are available at YSPH.
I'll say briefly too. I have a good number of friends that are in the health policy stuff and in the health policy department, and they're doing research. And it's just so like coming from like a small town in California, and it's so cool to see like just how what they're doing is so crazy. It blows my mind. Like people working with the senators here, or people working directly with the CDC or whatever. The opportunities across the board are really, really amazing.
Wonderful. So how, you can speak broadly if you don't feel comfortable kind of sharing your payment or employment status with these positions, but kind of how common and accessible are paid research opportunities? Do you, either from experience or from kind of what your classmates have seen, do you find that most of them are paid roles, are not paid, are for credit, are kind of a combination, and kind of what does that look like?
I think if you show that you're interested and like very serious about the role right away, oftentimes it is paid right away too, from my experience at least. I think the pay tends to be like 13, I think I get paid like $13.75 an hour, which having worked in the industry before, this kind of hurts, but you know, at least it's paid. My recommendation is, if you're looking to actually make money, is to work for the School of Medicine, because they pay pretty well. And I think having a paid intern or having a paid research position is not very hard to find. But I do know if you just kind of want to feel it out and see if you even like working in like a wet lab, or if you like working in a dry lab, usually what happens is, like, if you just want to test it out, it'll be kind of low stakes. The professor will work with you. It might not be paid right away, but if you decide that you're really interested in your project kind of pans out, then I think it usually ends up going to paying.
And I can just add, I think during undergrad and when I was a bit younger, any research experiences, it was kind of like you had to sell your soul to get an experience, and there was no pay necessarily, or a lot of the opportunities were not paid. And, you know, their pay to you was taking you on. Whereas here, I think people kind of, or professors and labs and everything, they recognize that we are graduate students. And so I think a lot of opportunities are paid in actual money, but if they're not, then, you know, they're paid in some way, whether that be mentorship or, you know, getting really great letters of recommendation, or, you know, advising and things like that. So I think, you know, there's definitely opportunity to find actual paid roles. Those do exist. And like you said, Alex, I work at the med school and make $14 an hour. So, you know, it's not really that much more. I get 25 extra cents, but I think, you know, you'll be paid in some way, whether that's in actual funds or not. And you'll always get something out of an opportunity. So I wouldn't worry that you're going to be like, you know, doing all this work for no reason, just for like a resume builder. You'll get something out of it for sure.
And I want to add something really quickly too. If you really need to get paid, I think being honest with the professor and just being like, look, I also need to make money in some way. If they really don't have the funding for it, it's better to know before you like get really committed to a project, because there are so many different paid positions. And the same thing goes, someone had asked publication opportunities, like talking about that with professors. I think it's good to talk about that with your PI, like maybe not the very first meeting, but like let them know early on you're looking to get, you're looking to do published research, and that's an important thing to establish early. And they're usually really, really kind about it. They get it, they went through the whole thing too, so.
And both of my positions are unpaid, so I can talk a little bit about that. Most of what I'm working on was more of an informal setup, just me reaching out to professors and saying, hi, I'm not sure if you have a position, but I'm really interested in your research. Can I contribute in any capacity? And so my positions are not paid, but over the summer, I'm actually in the process of applying right now to YSPH's summer internship awards and summer internship grants. And those are for students who are pursuing an unpaid internship. And you can apply to so many different grants, and they'll help cover housing and food and utilities, or just to try to offset some of those costs. So even if you do pursue an unpaid internship, there are ways and different foundations and stuff you can apply to. Becca can speak more to that, to kind of offset the cost of not having an income.
Great, thanks. So there are a few questions about kind of the experience outside of just classes and your research work. Kind of what does that look like? I would say, I'm gonna say take with a grain of salt. I know you are all first year students, so I think your experience has been very different than we're hoping the experience will be in the fall, when we are primarily, hopefully, back on campus and more vaccinated and in a better place with COVID. But if any of you could speak a little bit about kind of what your experience with the YSPH student community looks like, and kind of, we talked a little bit about the balance of time, but do you feel like most of your time here is spent in that kind of either academics or your research work, or are there other extracurriculars you're involved in, any other kind of student activities?
So in terms of, getting to know your YSPH community, it has definitely, I imagine it's very, very different from what it was for, say, this second years who, got to know their cohorts pre-COVID. But I guess I'm very thankful for the community that I was able to, create, and the community within my cohort, given the circumstances. Alex and I are both first year EMD students, and, just through, I guess being in our little EMD group chat or something, the first years just being like, oh, hey, how about we go for, a walk somewhere? How about, if it's the summer, let's go to the beach or something. We were able to, form those connections early on, and, having that support system, especially during COVID, has been really awesome and something I'm really thankful for. And, hopefully in the fall, you guys will have more, structured activities that you can go to and meet each other. But I would see, even, given the current circumstances, we have been able to generate this community of support that has been really awesome.
And I'll just add that I completely attribute the fact that things are a little slower socially to COVID. And I don't think that is, a product of Yale or New Haven or this program. I think it is completely just that, it's hard to get to know people over Zoom, and it's a little difficult to gauge whether or not, people are comfortable getting together. And if they're not, then, what can you do? A Zoom happy hour is great, but not, conducive to really deep friendships necessarily. And so I don't think that that's something everyone should worry about, especially if things are a little more normal in the fall. And I would also just say that professors have been really great at trying to organize things for students, forcing us into like study groups that have not but also really for the purpose of helping us to get to know one another. And I really do believe that I would be far lonelier had I chosen a different program. I think they have done everything that they can, everything that public health guidelines allow to try and make the social transition a bit easier for us. And I imagine that from this point on and future incoming classes, it will be much easier.
Yeah, I completely agree with what Julia said. My specific department, CDE, started something called CDE on the Move. And so we can sign up online and we can go on distance masked walks with professors, and professors just put online what hours they're available, and we can sign up for walks with different professors to get to know them and get to know other students in our department. And I think the biggest takeaway for me from the past couple of semesters is that regardless of what school looks like, everyone is trying to meet people and everyone is making an effort to try to get to know each other too. So personally, my best friend in the program, we got to know each other because during a class we were talking about research interests and we had similar interests, and we just direct messaged each other on Zoom, and then we got coffee. And so regardless of like how like conventional outside of pandemic times it looks, everyone is trying to meet new people as well. And yeah.
And I'll say just one last thing, echoing everything that they said. I, moved from across the country, got here, had no friends. And I'm definitely an extrovert. So like, it was pretty rough in the beginning, I won't lie. Just felt weird, all the way around. But everyone here was in the same boat. And it, once you get past the awkward stage of just being like, hey, we're on Zoom, this is weird, can we like go on a walk sometime? It's a lot easier. Also, the second years, I think like since they got to know each other before COVID, it was a little harder to reach them, honestly. But now that we've gone through that and know what it's like to go through like the first year of school being mostly online, I personally am going to make it like an express mission of mine to get to know the first years coming in next year way better. I want to like be able to connect them with other second years and other first years. And I really want that to be like a central thing for me next semester. So yeah, that's an open invitation to email me when you get here if you can't find a good community or anything like that.
Definitely, you can have my email as well. And I'm going to be TFing, or I'm going to be a teaching fellow for the Intro to Epi course. So I might even have some of you guys next semester.
So thank you. I'll also say that everyone should have access to our student ambassador directory that lists out all of our ambassadors. I think most of you are ambassadors, but regardless, lists out our student ambassadors, a little bit about them, their interests, their backgrounds, kind of describes our experiences here. And so feel free to reach out to any students within that if you have kind of other questions about the experience. And we are having our kind of departmental sessions all week in the evenings. So at noontime every day is a different session about each department led by the faculty, where they're talking a little bit more about the curriculum, research within the like research topics and interest areas within the department. But our 5 o'clock sessions are led by the student ambassadors in each department to talk a little bit more about their experiences. So I encourage you to join those. You don't have to stick just within the department that you're in. You're welcome to attend any of them. The last question that I want to make sure we address, and then I have a few kind of closing remarks, is could you touch on the process of applying to summer grants and fellowships with YSPH?
So the one I'm applying for right now, we get emails all the time with research opportunities, grant fellowships. It's called the Career Talks email thread. And I see opportunities in my inbox every single day, pretty much. And I saw this one in my inbox, and I also heard about it from a couple of professors who reminded me. They kind of knew what I was working on and just wanted to make sure that I was on top of everything. And there's a student portal with just a ton of grants and fellowships you can apply for, specific to either research interests, schools. There are some through the School of Medicine, School of Public Health, undergrad. And you could just put in what type of research you're conducting, what school you're in, and a list of eligible fellowships and grants pop up, and you just submit your project proposal or proposed budget, resume, and yeah, you can apply and they'll get back to you.
Thank you. And yes, like Danielle mentioned, the Career Talk message that the Career Services Center sends out has a lot of great resources for research opportunities, internships, job postings, funding. We really want to make sure specifically for the summer that students are able to have the experience they want to have. And we want to help you figure out how to financially make that happen. And so the career management team is going to be a great resource in those kind of opportunities. So kind of, I've seen a few other questions. What I wanted to end with was about kind of specific situations, interested in an MD, what kind of would we recommend for research versus applied practice, other things about, looking for a PhD publications. I think that ultimately our message and our hope within the program is that you're really able to tailor it to what you want to get out of it. And that you're going to have the resources available to help you figure that out. So I think everyone has touched on connections with faculty members. Like Danielle just said, faculty members reached out to say, hey, I was thinking of you, this came up. That I think it is really important to us within the program that everybody has a little bit different of a set of goals or perspective they bring in and want to get out of the program. And, between career management, between our Office of Public Health Practice, your faculty advisor, the concentration program coordinators, there's a lot of support to help you kind of figure out what, based on kind of your goals, are the best opportunities are going to be. And I hope that you have all had that experience. But that's really what we strive for. So with that, I want to thank you all. Thank the four of you for your time, for sharing your experiences. I really appreciate it. I learned a lot from you about your experience within the program and what you're kind of participating in. And thank you to everyone for joining and for asking questions. Like I've said, if you have anything else that comes up, don't hesitate at all to reach out to us. We're always happy to help.